Today, Maddie and I are going to do a quick presentation on one of our new resources, as well as on nutrition and IBD as a whole. We were also supposed to have Missy as part of this presentation, but unfortunately she's not feeling well, so she won't be joining us, but we're keeping her in our thoughts. Next slide. So a little outline of what we're going to be talking about. We're going to have some patient stories about experiences with different nutritional therapies, as well as why it's important to talk about nutrition in clinic and talking about nutrition with patients and parents generally. Then we're going to discuss a little bit about patient-developed resources, and then if we have time, we'll do a little bit of Q&A. Next slide. So by the end of this session, here are some things that you should take home with you. The first is to understand the importance of discussing nutrition with patients and their families. So this is not only applicable to the clinic setting, but also at home if you're a parent. And then also, understanding the importance of creating a multidisciplinary team that incorporates dietitians and nutritionists, as well as you should know where our resources are about nutrition and IBD, and you should be able to access them and use them. Next slide. Okay, so first off, I'm going to let Maddie take the wheel, introduce herself, and then go ahead with what she wants to talk about.
Hi, everyone. Chris, we can advance slides. So I'm going to be talking a little bit about my experiences with exclusive enteral nutrition, or EEN. I went on EEN for the first time following my diagnosis of Crohn's disease in January 2015. I was on tube feedings for about 1.5 years, and I was able to achieve remission without the use of steroids and solely with exclusive enteral nutrition. So some pros for me through that experience were, one, the remission without steroids. For me and my family, exclusive enteral nutrition was a good fit, and I was willing to take that challenge on, and overall I was able to avoid the use of steroids. Two, the mucosal healing. So exclusive enteral nutrition has demonstrated an ability to promote healing of the lining of the GI tract, or the mucosal healing. So through that, I was able to gain a healthy body weight. And then it also served as a really life-changing learning opportunity. If I could go back, I wouldn't change my decision to choose NG tube feedings and EEN, because I learned so much about my body through that process. Not to say that it was easy, which it was not, and I don't want to minimize the experience of other people by saying that I wouldn't change my experience, but I did learn a lot about myself through that. And also I learned to place my own NG tube, which is a huge benefit when doing tube feeding. I think having the control of placing your own tube and knowing where it is in your body gives a lot of empowerment to the patient. And also it's like the coolest party trick ever for any peer group in general that I've ever showed it to. I've been very, very impressed. So again, I learned so much about how my body works through that process. And then some of the cons, there is an emotional impact, and exclusive enteral nutrition and NG tube feedings aren't easy. It's like any therapy, it requires commitment, and with that comes an emotional impact. For me, it was worth the commitment and emotional impact, and I was able to cope with that. Though I do know that it is not something every family can comply with. Because food is a huge part of our culture, and sharing food is a relational experience. So missing out on that can lead to feelings of isolation or loneliness. For some families or patients, maintaining treatment compliance can be difficult. Any therapy requires dedication and compliance. And if this is an issue, it may be necessary to choose a different therapy. We can move to the next slide. So from a patient perspective, I have some suggestions for how to promote a healthy experience for patients using exclusive enteral nutrition. This may seem obvious, but listen and communicate. This is the patient's body, and it's rather scary to have a tube placed, and having a space where they can say what they want is important. consider the emotional impact. As discussed previously, it can be lonely. And so making a decision with those things in mind is important. And finding relationships or finding ways to stay in relationship with food, for me especially, was important, because I really craved the relational aspect of sharing food. And so to help with that, I started making food for other people. And through that experience, I was able to continue forming those relationships. And that's all I have. So I think I'll pass it on to Kat.
Great. Thank you, Maddie. So I'm going to talk a little bit about how you can discuss nutrition in clinic as well as more broadly. So for some context, I'm 22 now. I've been diagnosed with Crohn's for the last 12 years. And I was managed entirely nutritionally with a specific carbohydrate diet and exclusive enteral nutrition for 8 of those 12 years. So I have a long history with nutritional therapy when it comes to treating my IBD. And I really try to emphasize the importance of discussing nutrition in clinic. I think a lot of families come up to me both as part of my patient advocacy work as well as within my professional life and are concerned about nutrition. You know, it seems to make sense that a gastrointestinal condition would be somehow impacted by what you're eating. And so patients and families often have questions, and I think discussing nutrition in clinic can be a good way of answering those questions in a way that's verified by data instead of potentially getting unverified information off the internet. I also think it's helpful for a sense of control. I think IBD, as well as all of the treatments that are often, the pharmaceutical treatments that are often prescribed for it, can be rather difficult to understand. And so having a nutritional plan, or at least knowing a little bit about how nutrition can impact IBD, can be helpful for patients and families to have a sense of control over their condition, as well as understanding IBD as a whole. So if you talk about nutrition, you can talk about the microbiome, for example, and how that has a part to play in IBD. I know that a lot of physicians and center staff might be apprehensive about discussing nutrition with their patients. And so what I recommend for providers is to discuss a healthy diet broadly if you're not comfortable recommending one specific dietary therapy, as well as to assess the patients for potential disordered eating patterns. I've met a number of patients over the course of their IBD have developed disordered eating patterns, and I think that these can have a health impact that are important to discuss with your patients. And then really using those remission appointments where you don't have to discuss any short-term strategies for putting the disease into remission to talk about something like daily intake. You know, is your patient eating a balanced diet? Are they eating regular meals? And how does their eating schedule impact their quality of life during the period in which they're in remission? Next slide. So I also wanted to talk quickly about nutrition and weight. So you'll see on the left there, the first photo is 6 months before I was diagnosed with IBD at the age of 10, and the second photo is 2 months afterwards. And so you can see a big weight drop, and I think especially the way that social media is impacting kids nowadays, it can be important to really make sure that we're talking about weight in a way that is healthy and that avoids weight stigma. I think many teenage IBD patients, female patients especially, are at a very sensitive age to discuss weight. And so weight gain especially can seem like a negative thing societally, whereas in IBD patients, a lot of times weight gain can be a positive sign of recovering from remission. But even when I was flaring, I was told a lot, like, how are you losing all this weight? You know, how are you getting so skinny? And I didn't have the guts to tell them that it's because I was going to the bathroom 10 times a day, and that was my dietary strategy. But I think it just really emphasizes that we need to talk about weight gain and weight loss with IBD patients from a position of curiosity instead of a position of assigning positive and negative value. So for example, some ways to talk about this are saying, you know, how do you feel about your body now? after gaining or losing weight, or it looks like you gained some weight, how does that make you feel? Or if your patient has had a long period of flare and has lost a lot of weight, saying, you gained some weight, that's amazing, and establishing a positive association with weight gain when a patient is recovering from a flare. And this can be especially important not only in the clinic, but as well as in the house. And making sure that patients want to see or know their weight when you're weighing them in clinic can be important, because you never know who might get triggered by seeing that number on the scale. Next slide. So I'm going to run through Missy's slides quickly, but some of the pros in discussing nutrition generally, it can increase awareness of nutrition in your population and how nutrition can impact IBD. It can also help with treatment compliance, because patients have a handle on every aspect of their condition, not necessarily just pharmaceutical interventions, and they can understand through nutrition how even their pharmaceutical treatments are actually impacting their disease. It also increases the comfort with patients discussing possible nutritional therapies with a provider instead of going rogue and doing it on their own. And it fosters positive thinking about nutrition and body image in a social atmosphere that makes it often difficult to discuss these things in a positive way. It may also be frustrating at times to talk about nutrition generally. I know a lot of families might hold on to treatments that aren't necessarily working for their child, but I think the pros outweigh the cons, even if there's just 4 exclamation points or 4 points for the pros and 1 for the con. It's very clear that it's outweighing the cons dramatically. Next slide. So here are some ways to discuss positive conversations. The first is to talk with patients outside of clinic, whether that's in a patient education day, or if you're referring them to a dietitian as part of their treatment. I think talking about nutrition in general throughout their lives is important, even in the home as well. Next slide, or next bullet point rather. Next. So I think it's important to make sure that you're listening to the patient, see what thoughts they have currently about nutrition, and maybe what ideas they have about what they should or should not be doing. And ask, like I said previously, about the patient's relationship with food, their food habits generally, what they're doing nutritionally for themselves, and feelings about nutritional therapies in general, whether that's simply exclusive enteral nutrition at one extreme, or just eating a balanced diet and incorporating more fruits and vegetables, for example. And we want to emphasize that this should be done routinely. I think it's something important to do, especially when the patient is in remission and you have more time during those limited clinic appointments. Next slide. Next. So here are some other ways that it might be helpful to talk about nutrition. Patients will be more comfortable asking questions in clinic. You make sure that you're open in communication, which can be especially important in a pediatric population. It might also prevent against unhealthy eating habits or mental health issues related to weight or eating. And it makes nutrition central for care, the team, as well as patients and families, and can be a great impetus for incorporating a more multidisciplinary team in your clinic. And it also may have unexpected benefits, like educating your patients on nutrition, as well as making them feel more confident in who they are mentally, which can have an impact on their physical health. Next slide. So we want to talk quickly about some of our resources. Next. The first is a nutrition and IBD toolkit that Maddie and Missy have been charged in creating, that has been recently released to the ICN community. I think Chris mentioned it earlier. And like all of our resources, it's a patient-developed resources that talks about personal stories with nutritional therapies, anything from total parental nutrition, special diets, nutritional shakes, NG tubes, as well as it provides the expertise of registered dietitians that are part of the community. Our audience is patients, families, and IBD care providers, and we also present data on IBD and nutrition. So to create this toolkit, we gathered the perspectives of the 60 patients in the Patient Advisory Council, and we gathered all of that data and were able to create a summary of some of the patients who are using different nutritional therapies. For example, on the bottom right, you can see, it's kind of hard to read, but it's a pie chart of the percentages of patients using NG tubes. Next slide. And we also have stories. I think these stories are incredibly beneficial for helping patients, like the testimonial that Chris gave, to feel less isolated. I think nutritional therapies especially can feel like you're the only one who can eat certain things, or you're the only one who can't go out to dinner with your friends. And so it's really helpful, I think, for patients to hear other folks' stories, and as well as to get advice from them. So if that's anything from, Maddie saying that putting her NG tube in was a cool party trick, and maybe using that as a way to introduce it to your friends, or just, knowing how to do EEN and diversify the taste of the formula that you're drinking. Next slide. And this is another toolkit that's currently in the final stages of production. Maddie, do you want to talk about this one quickly?
So disordered eating is, as Kat mentioned, something that can affect an IBD patient's quality of life, from nutritional experiences with therapies, or just general day-to-day symptoms. Those are all things that can impact an IBD patient's relationship with food. So we developed this resource using PAC surveys. So it's a patient-developed resource based on the information that PAC members gave us about their experiences with disordered eating patterns. So we have a disordered eating Q&A with both patient and expert experiences, and then an informative section on managing disordered eating habits and behaviors on a day-to-day from a patient perspective. And the intended audience is parents and patients, as well as IBD care providers. We're hoping to reach the whole spectrum of the community with this toolkit.
Next slide. Alrighty, so we want to open up, we have a couple of minutes, I think, for question and answer. So if you have any questions about nutrition, about our resources, all of our resources are available on the Improved Career Now website under the Tools tab. But yeah, any questions about nutrition generally, please feel free to put them in the chat box and we can address them.
Kat, I know it takes sometimes somebody jumping in to write the first question. What are some common questions that you get, or that people maybe think of? Are there things that people ask at the in-person community conference that you remember, that stood out, that you could share?
Yeah.
Go ahead.
That's good. I think one of the things that we often don't talk about is stigma related to height, especially in male patients. Given that the Patient Advisory Council is mostly female, we have a tendency to not discuss that as much, but I think that goes along with discussing stigma and weight. Also addressing height is important. I think that the term failure to thrive, which is often used to describe lack of growth in a pediatric population, is kind of brutal. And so making sure that especially your male patients who tend to be a little bit shorter, given a lack of proper nutritional status, have role models like Missy, for example, who are pretty short men, but who are very successful, can be valuable, as well as doing that in the home if you're a parent with a young male patient who perhaps is not to the same.
Sometimes that is presented.
Hopefully that makes sense. Lisa Pitch put in the chat box, how much input did you have when you were younger versus your parents about what type of nutritional therapy you choose? So I think Maddie and I could both discuss this. I really wasn't given much of a choice. I think it was my parents who were scared about what they had read about biologics. I don't think folks should be scared of biologics, but at that point, there weren't as many options for IBD patients. And so my mom read about nutritional therapies in a book and decided to try me on exclusive enteral nutrition, even though my physician actually hadn't even mentioned it. So I didn't have much of a choice in what type of nutritional therapy I was using, but once I moved away for college, I actually decided to stop using nutritional therapy because my disease was flaring really badly, and at that point, I was given more of a choice. Maddie, do you want to talk about that quickly as well?
I can share a little bit. I had an experience unlike Kat. I was given a lot of information. It was more of a discussion between all of the members of my family about what we wanted to choose. And in the end, we decided that we felt we could take on nutritional therapy over using steroids or biologics. And I felt like I did have a wonderful amount of information, both provided from my physician, my GI doc, and my dietitian, and my parents. So
a wide variety there. So to talk about Lee Beck mentioned Jenny David's disordered eating and body image study. So Jenny David is a current psychology fellow who is at Drexel, who was also a part of the Patient Advisory Council. And so she is currently, I think, wrapping up a study on disordered eating and body image. This isn't that study, but we are talking to her when creating this toolkit to gather all of her expertise about disordered eating. But hopefully her study will provide a lot more insight in a randomized or a quantitative matter regarding disordered eating and body image in IBD populations. I'm also seeing some questions about how long did it take to get into remission with nutritional therapy. I think that's independent, based on the patient individually. For me, I when I was on exclusive enteral nutrition, I saw results in terms of symptom management in the first 2 weeks of a formula-based diet, but then I continued, as is the recommendation, with formula diet for another 6 weeks. So that 6-week period put me into full remission, but I started seeing results within 2 weeks. Maddie, do you remember how quickly you could see?
Yeah, I had a really similar experience. Symptom management wise, it was within 3 or 4 weeks, and then it took probably a couple months for me to achieve remission. And I continued on exclusive enteral nutrition after that, but it was probably a couple months.
Right, and all of that obviously is individual to how much inflammation the child has, as well as what their symptoms are. Okay, so another question: what are some things your parents said or did that helped you develop a positive body? So I think one of the things that was really beneficial for me was being encouraged to throw out all of the clothes that didn't fit me anymore. I was holding on to a lot of the clothes from when I was flaring, and that wasn't beneficial for my mental health once I got older. And so I had a big clean out of my closet and tossed out all the clothes that didn't fit me, so that when I went back into my closet every morning, I didn't have to think about the fact that, I was hoping that maybe one day I would fit into those smaller clothes. And so that was really beneficial for me, as well as I think following body positive Instagram folks is beneficial, and it kind of calms down all of the highly stylized photos that you see on those kinds of websites. Maddie, do you have any recommendations for ways to develop positive body image?
For me, one of the biggest factors has been getting into an exercise routine. I think no matter how my body looks, feeling alive in my body has impacted my body image more than anything else. Finding activities that make me feel good about myself and feel like I am strong and capable and able to do things that I want to do, make me feel proud of my body rather than looking at it from a more aesthetic point of view. And so things like yoga or meditation or things that are more contemplative, I found that running is really, that's what fits for me, but there's a lot of different options out there to get patients feeling like their bodies are functioning again.
That's great. We also got a question in terms of exclusive enteral nutrition and eating. So when I was on exclusive enteral nutrition, I didn't eat, but that was just the protocol that was recommended to me by my physician. I know that exclusive enteral nutrition can be followed differently based on different patients. Did you eat at all during your EEN, Maddie?
Yeah, I did. I did between 200 and 300 calories of solid SCD food every night. So that was my only intake of solid food calories.
Great. So that kind of protocols can vary somewhat between different centers. And if you have a interest in exclusive enteral nutrition, we would encourage you to talk to your physician and see what your options are, as well as how your specific center is recommending that patients follow EEN. So Paul also asked, what nutrition drinks did you use, and why not try to drink them instead of using NG? So I actually did drink all of my EEN nutrition drinks. I won't tell you which one I used because the formula has changed and it was no longer, or it wasn't nutritionally complete when I used it. But I did try to drink them. I will say there are pros and cons to drinking them. Like I was able to maintain my energy levels during the day, but my breath did smell terrible. And it was sometimes hard to get all of that volume of fluid down. Maddie, maybe you can talk about why you chose the NG tube.
Yeah, for me, formula fatigue was a thing. I was managing some depression during that time, and it was hard to get myself to eat or drink per se. So using NG tubes as a way to get calories into my body was an important thing. I used Ensure the first time I went on exclusive enteral nutrition, and then the second time I used Kate Farms, which is a plant-based formula that was closer to, that was following a period of using this specific carbohydrate diet, so it was closer to what my microbiome was able to process, and it was less of an extreme jump than using a more processed formula such as Ensure or Boost.
And I will say that it's important to mention that not all insurance companies will cover drinking with EEN. They're actually more likely to cover the shakes with exclusive enteral nutrition if they're taken by NG tubes. So if you have a family that has financial concerns with trying exclusive enteral nutrition, as it can eventually become kind of expensive, potentially exploring the opportunity of using an NG tube can be beneficial from a financial point of view. Any other questions before we wrap up? I think Chris might encourage us to wrap up soon, so maybe one more question.
Well, while we see if anybody has anything they're typing in, I want to question maybe the wrong word. You're sharing a lot of the experiences that you had, and I want to acknowledge that there may be a tendency of folks to be like, oh, that worked for them, that'll work for us, and I'm going to go do it. If you hear something that you think would work from you, we certainly encourage everybody to like go talk to your physician first, or make sure you get the right fit for you. There's another question, but I wanted to say that Kat or Maddie, if you have any comment on, on what I just said too, but Jed has a question that they just typed in.
Yeah, I definitely would agree with you, Chris. I think it's every treatment with IBD is individual to the individual patient, and so even there are some things that work for our bodies, it might not work for every patient, and we would encourage you to discuss these things with your physicians.
Absolutely.
And then Paul or Jed asked, was there a social impact to your EEN diet? I mean, for me, absolutely. It's a lot of our social events revolve around food, and so I had to pivot to making more of my social interaction with my friends around activities that didn't involve food. So, for example, we would go to the movies because unless people were buying popcorn, it was not as food centered, or we would do things like go play a soccer game or something, and then I wouldn't go for the dinner afterwards. I was also an only child, and so the impact of me not eating was could be buffered a lot by my parents, but if you have a family with a lot of kids, it might be difficult to separate one child if they're having a difficult time not consuming food while their siblings are. Maddie, I bet you can talk about social impact.
Yeah, so like Kat said, there's a huge social connection, building relationships in our culture surrounding food. So I did find alternative ways to engage those situations. So like I said, I brought food to school that I made, so I was contributing to that. And then I also would, at dinner time, I would either warm my Ensure up or my Cape Farms, or I would freeze it into a popsicle, or I would put it in an ice cream maker, or do something to the extent that it was different, which also helped with that. I was feeling like I had some variation there, and also there are different flavors to those drinks. So finding, like, I don't know, for the longest time I drank the chocolate flavors of those drinks before I realized that there was a strawberry and a vanilla, and that was absolutely life-changing. So creating as much variation as I could and adapting to those situations as was emotionally appropriate was how I managed that.
And I think with that, we'll give it over to you, Chris.
Great, thank you so much.